Hello, everyone. My name is Dornoosh, one of the 3 co-founders of medo.ai, and it's such a pleasure to be here today. Thank you, Reg and Antonio, for the invite. I want to talk a little bit about my and Medo journey. Medo is a new health tech startup in town that we are excited to be building it. In Medo, our vision is to decentralize medical imaging and bring the access to the point of care. Let me explain why we are so focused on medical imaging. Patient care can only start after diagnosis, and diagnosis relies heavily on medical imaging. Yet, 2/3 of the world population have zero access to it. For the rest of us, access to it is very limited, very centralized. We need to get to our family doctor, then get referred to the right specialist, then get referred to radiology, wait and wait and wait, just to get a diagnosis. Well, this wait can be the difference between a stage 1 cancer and a terminal cancer. This wait can be the difference between a disease that is treatable or even preventable. That's something that's not curable. Well, I personally realized this problem when, for the first time, I started working in a hospital as a data scientist. I used to watch patients having to wait months or drive hours and hours in the middle of winter, or even flying from thousands of kilometers just to get the imaging done. And during that time, I met my other 2 co-founders, Jacob and Jivesh. Both of them are senior radiologists. And we realized that 3 of us share a vision, democratizing medical imaging. And because of that, we founded a research entity called CUDDLE. And we started collaborating with more than 10 leading hospitals, from University of Alberta to Stanford, all the way to University of Melbourne. Many exciting things came out of that research, but after a while we realized if this stays as research, it will forever stay in tertiary center hospitals and would not reach the people who actually need it. And that is why, around a year ago, Medo was born. Our solution might remind you of the medical tricorder from the Star Trek. I'm sure you would remember that device. It's a fascinating handheld device that can diagnose almost anything within the human body, and almost anyone could use it. Imagine if we had that device. Doctors in remote areas could use it, ambulances could use it, caregivers in elderly homes could use it. Well, of course, that's science fiction. But in Medo, we believe in the age of artificial intelligence and cloud computing, the concept of medical tricorder might not necessarily to remain as a dream. And this is what we're working on. And I have a very good news for you. The device, the technology, is already available, easily, cheaply, and readily. It's ultrasound technology. Ultrasound is safe, very cheap, and truly portable. Ultrasound is the only imaging modality that you can actually fit into your pocket and easily reach every patient. But of course, there's a trick. There's a reason why people are not using it. It is extremely difficult to work with ultrasound. It's a handheld device. So it requires years and years of training, and it's inconsistent and unreliable in less than an expert hand. So yes, the devices are easily and readily available, but we do not have enough expertise to go with the devices, and this is where Medo comes in. We are building technologies that would radically simplify the use of ultrasound, taking away that operator dependency, taking away that requirement for years and years of training. And we do have a working prototype already available for diagnosing a hip defect in babies. And that prototype has been tested in 5 leading children's hospitals in 4 countries. And in a clinical trials on more than 1,700 patients, we proved not only that our technology is feasible, but that it's up to 20% more accurate than an expert radiologist. I always feel very bad when I say this, and I'm happy my co-founders are not in the room. But we are very excited about this result, and very busy working on other functionalities from thyroid to kidney and liver. And I want to just wrap up with a few fun facts about our team. We are a small team. More than 40% of us are women. We speak in total 12 languages, and we work in 5 different time zones. Thank you so much.